Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation. And good morning, Ian. Okay, so morning for me, now afternoon for you, as I'm based in the UK and you are based in the lovely Greece. But I guess I would like to begin by asking you to introduce yourself.
Hi, Harvey. Nice to see you again. It's been a while. My name is Ian. I'm Kenyan, and I live in Greece. I am a psychotherapist, a holistic psychotherapist, which means that I'm using all different approaches, psychological approaches that are there. But I'm also accustoming myself using my own beliefs and cultural and African background. I used to be, and I still am, an interpreter and translator. I am a nurse and a psychologist and psychotherapist and artist, performance artist also. I use all of these arts intentionally to help me to kind of create and bridge the gaps that I see in my own personal life and also in the community where I live.
It's so interesting how much I learn about you every time I speak to you. The first time I met you, I maybe met you in one context. We spoke a bit via email. We then spoke, of course, recently as yesterday as we were trying to prepare for today's recording. And every time that we talk a bit more about what you do, there's something new that appears. And I think that people, when they talk about people acting as consultants or people being able to bring expertise to a situation, people say, what makes you a consultant that doesn't, make someone else a consultant, or what I can be a consultant, or, and it's recognizing the journey that we all go on, the bits and pieces of expertise that we pick up along the way. And when we bring it all together, sometimes it's tough to find, I guess, one role that would really encompass all of that expertise, and without you feeling like you're betraying a part of yourself by abandoning it along the wayside so that you can go for another opportunity. So thank you so much for sharing that, by providing context, much needed context around what it means to be a consultant and to wear many hats, and how that can be used to benefit multiple different types of populations.
I studied nursing so that I can be helpful to other people. But then while I was in the hospital, I realized that there is a huge gap, a language barrier for migrants living in Greece. Everyone in Greece speaks Greek. So if you're someone from somewhere else, if you want to convey a message or to communicate, you need to speak the language. So there was a huge barrier there. So I saw the gap. I trained to become an interpreter and a translator. And that was my effort to bridge the gap and to actually allow people to express their needs in the hospital setting. That led me to a different path of life, which led me to the asylum service, where I was interpreting for people who were seeking international protection. And then through this, I became a freelancer, and I started getting calls to help people with psychologists, psychiatrists. So in a way, it opened my world into the field, the humanitarian field. So through interpretation, I had the opportunity to enter different professions and work and become the voice of the professionals towards the beneficiaries and the voice of the beneficiaries towards the professionals. So that was the beginning of my journey, I would say. And that's where I decided that I would also like to become a psychologist and a psychotherapist, because there were no people of color and migrant psychotherapists, psychologists here in Athens and in Greece in general. So I wanted to be there and to find a way to bring my own lived experience as a migrant, and to bring all these voices and all the voices that I've heard throughout those years, to give them a space, and to be the person on the other side of the table who will be able to listen and will be able to give some kind of comfort, safety, and just to be there. Because from my experience, people have been traveling a lot, migration, and rarely do people give them the opportunity to be heard with dignity and respect. So this is the reason why I wanted to become a psychotherapist, and is to be able to be there for people, to be there to listen to them, to be there to help them in their journey to become whole again. Because I realized that being in the hospital just treats the physical side, the physical body, but the spirit and the soul and the mental health of someone, no one takes care of that. No one was paying attention to that side of people. So that's what I wanted to be part of, and to try to create such spaces uh, for people to be able to feel safe and comfortable to talk and to meet other people as peers, and just to feel whole again. When you go for a service, you might not be treated fairly due to your social status, due to your age, due to your race, due to how you look, the clothes that you're wearing, the language that you're speaking. So my role is to kind of bridge that gap using my own expertise.
So it's really interesting that you mentioned fairness, actually, because what some people might, I guess, the lay person might refer to as fairness is what we're talking about today, which is actually the topic of equity, which is one of the 8 principles that we sort of base this series on. So how would you say your interest has been sparked in equity and how it relates to the work that you're doing, whether with individuals or groups of individuals?
Well, I would say that fairness, as you mentioned it, for most people is something that we take for granted, but it's not for granted. As I mentioned before, I was born in Kenya and we migrated to Greece. So for most of my adult life, I lived as a Kenyan who migrated into Greece. So that meant that I had some rights, but I did not have the full rights as a citizen, which means that access to many benefits and many services was second class. I did not have full access to many things. Uh, I can give an example when it has to do with healthcare. Uh, it's free medication and universal health, and everyone who has documentation and everything, you have free access to medicine. But if you don't speak the language, how can you be cured? If the other person does not understand my culture and the reason why I do not want to confide or to share some personal things with someone else, how can I get the full treatment? How can I be whole if the other person does not understand me? Uh, Another thing about fairness, being from another country and coming to a different country, which the language is different, how do you get access to the information about health, about where the service is, and how you can communicate to the other person? How how can the whole society and system help someone who just arrived, or even someone who lives in the same context, but they don't know what their rights are, how they can access any kind of service? The information is not there. It's not. We take so many things for granted, but we forget that some people do not know or do not have the access to this kind of information, and that is where my spark came in. Information is power. So, and when you have information, it's easy for you to bridge the gap and to bring equality uh, to the services that are the bare minimum.
It's interesting that you say using equity to bring about equality, and that's the relationship between the two words that I think is often missed. People sort of use them interchangeably, or they'll say, we're aiming for equality or we're aiming for equity, when actually they're two different words with two different meanings that are part of the same journey. And so thank you so much for utilizing that example. Really, really interesting to hear your perspective on that. So the next sort of question I have, I guess, again, you're in a great position to answer this question, because it's how we can make our work around equity more intersectional.
I believe that most important part is that everyone's lived experience makes them an expert. Anyone that you come into contact with, either it's the service user or the service provider, they have a certain kind of experience, and that is their lived experience. So that makes them experts in specific parts of whatever project that you might want to create. So what I do is I tap into that, and I invite them to join me in the creation of whichever project that I am creating. I do not just speak to service providers. In the project creation and implementation, I use the service providers to create the services that I need, because you cannot have equity without making it personal and individual. Equality can be as a group thing, but equity is individual for me. It needs to be personal. It needs to be tailor-made for each individual so that they can be their best. If you give someone the space, and even if as a consultant or anyone, if you give people the space and you allow them to bring their whole selves, they will bring different parts of their lives. And that those different parts are the ones that we need to create something that is accessible to everyone, and it's also equal to everyone. It's like a puzzle piece. It consists of different pieces. And if you take one piece from you and one piece from me and one piece from someone else, it creates a whole. And that whole is what we need. So, for example, for me, when creating a project, it's not just me as a consultant coming and just doing my job and leaving. It's me interacting with all the staff, interacting with the service providers, interacting with the community near the project or the clinic that I'm doing the consultation for, to see what is happening there, what is the need of the nearby community, what do they need, what does the clinic need, what does the professional need, what does the service service users need, and to create something from that.
And it's interesting you mentioned that in terms of what a consultant needs to be doing, because I think historically the views of consultants are that they're people who swoop in, they create loads of mess, they tell everyone that they're wrong, they make a couple of suggestions, and then they run away. And actually, we talk about consulting within the realm of health, well-being, and equality. It's quite the opposite, actually. We recognize the importance of relationships, of getting involved with all the different stakeholders, whether they're the ones providing the service, accessing and using the services, or those who are informing the service as part of the community. So, the relationship that we have as consultants within this space is very different to maybe, I don't know, a business consultant or a finance consultant who might think a bit differently about what their capacity is and what their responsibility is. So, but definitely pulling all of the different facets and pieces of the puzzle together of people, so that we have an informed perspective on how best to proceed with whatever we're planning and whatever program that we're trying to implement. So that's what I'm reflecting back to you, with the hopes that that's what I'm hearing you say, and you're nodding. Yeah. So that is accurate. So what would you say your call to action would be in terms of equity, reflecting on the things that you've just shared around how we need to be engaging differently as consultants or lived experience leaders, professionals, or even just members of the community?
I would say every person that you meet, you don't need to assume what their needs are. You need to ask them, what do you need? How can we work together? And not for us, because with all of this lived experience, you gain a lot of knowledge, and sometimes you forget that you don't know everything. And when it comes to equity, we need to ask the individual, what works for you? What do you need? How can I be of help and how can I use this knowledge that I have to make it individual and atomistic to work for you. So my call to action would be that every individual that we meet and every individual that we have the pleasure and the honor of being able to give and provide services to, we should always remember that we might know, but they know best how we can help them.
So not making assumptions, that is a very important one. And of course, consulting people, communicating, providing space for them to feed in. So that's absolutely the way forward. So thank you so much for that call to action. Ian, I think that if I was listening to this conversation, if I'd stumbled across this conversation, whether on social media, LinkedIn, wherever, or on YouTube or somewhere, and I was listening to the words that you were saying, and I wanted to know more about this, or I wanted to learn more about you as a practitioner, as a consultant, as someone who's contributing to the field, I'd want to get in contact. So how can people get in contact with you if they want to carry this conversation forward, or they want to connect with you, or figure out how they want to work with or partner with you?
Just send me an email and you can find me there. And also you can just, if you are interested, you can also see part of the work that we are doing here in Athens with a small organization, grassroots community-led organization that we created to help people to gain access, not just for migrants and refugees, but the general population, whoever is in need. We're there to help them and to support them. Either it's mental health or healthcare.
Brilliant. So we're going to provide your email at the bottom of the screen so people can sort of see that. We'll provide a link to Open Paths Athens so that people can look at the work that you're doing there, and a couple of other links as well relating to some of the work you're doing with Voicify EU, and then hopefully also have something for LinkedIn for you a bit later on. So Ian, all I can say is thank you. I'm experiencing high levels of gratitude at the moment for your contributions. I'm reminded through this conversation that there is a global conversation around equity that we need to be considering. It's not all about what's happening at our, the tips of our toes, but actually there's so much we can learn from other people who are based all around the world in other contexts, who are doing a very similar work for different populations, but utilizing the same principles. So thank you so much for your time today.
It's really important to have such conversations because it also reminds us, because we are also so busy, sometimes we forget why we are so passionate about what we are doing. And sometimes it's important just to sit and talk, just to reflect on what we are doing and why we are doing it, and why we force ourselves into specific tables and specific rooms, and why we do that. We do that so that we can keep a little bit the balances in terms of who is talking about what and who is in that room. So we need to be in those rooms, and we need also to bring our own experiences and to use them in whatever areas, spaces, and rooms that we are in to push for it.
Absolutely.
And equality also.
And equality as well. Thank you so much, Ian. Well, I wish you all the best with your continued work and your consultancy. I look forward to seeing where it goes and as it develops and the people who are going to be reached as a result. So thank you so much.
Thank you, Javi.